Stop smoking treatments. If you want to stop smoking, several different treatments are available from shops, pharmacies, and on prescription to help you beat your addiction and reduce withdrawal symptoms. The best treatment for you will depend on your personal preference, your age, whether you're pregnant or breastfeeding, and any medical conditions you have. Speak to your GP or an NHS stop smoking advisor for advice. Research has shown that all these methods can be effective. Importantly, evidence shows that they are most effective if used alongside support from an NHS stop smoking service. Nicotine replacement therapy, NRT. The main reason that people smoke is because they are addicted to nicotine. NRT is a medication that provides you with a low level of nicotine, without the tar, carbon monoxide, and other poisonous chemicals present in tobacco smoke. It can help reduce unpleasant withdrawal effects, such as bad moods and cravings, which may occur when you stop smoking. Where to get it and how to use it. NRT can be bought from pharmacies and some shops. It's also available on prescription from a doctor or NHS stop smoking service. It's available as skin patches, chewing gum, inhalators which look like plastic cigarettes, tablets, oral strips and lozenges, nasal and mouth spray. Patches release nicotine slowly. Some are worn all the time and some should be taken off at night. Inhalators, gum and sprays act more quickly and may be better for helping with cravings. There's no evidence that any single type of NRT is more effective than another. But there is good evidence to show that using a combination of NRT is more effective than using a single product. Often the best way to use NRT is to combine a patch with a faster-acting form such as gum, inhalator or nasal spray. Treatment with NRT usually lasts 8 to 12 weeks before you gradually reduce the dose and eventually stop. Who can use it? Most people are able to use NRT, including adults and children over 12 years of age, although children under 18 should not use the lozenges without getting medical advice first. Pregnant women, your doctor may suggest NRT if they think it would help you quit. Read more about stopping smoking in pregnancy. Breastfeeding women, your doctor can advise you how to do this safely. Always read the packet or leaflet before using NRT to check whether it's suitable for you. Sometimes it may be advisable to get medical advice first, for example if you have kidney or liver problems, or you've recently had a heart attack or stroke. Possible side effects. Side effects of NRT can include skin irritation when using patches, irritation of nose, throat or eyes when using a nasal spray, difficulty sleeping, insomnia, sometimes with vivid dreams, an upset stomach, dizziness, headaches. Any side effects are usually mild, but if they're particularly troublesome, contact your GP as the dose or type of NRT may need to be changed. Varenicline, Champix. Varenicline, brand name Champix, is a medicine that works in two ways. It reduces cravings for nicotine like NRT, but it also blocks the rewarding and reinforcing effects of smoking. Evidence suggests it's the most effective medicine for helping people stop smoking. Where to get it and how to use it. Varenicline is only available on prescription, so you'll usually need to see your GP or contact an NHS stop smoking service to get it. It's taken as 1 to 2 tablets a day. You should start taking it a week or two before you try to quit. A course of treatment usually lasts around 12 weeks, but it can be continued for longer if necessary. Who can use it? Varenicline is safe for most people to take, although there are some situations when it's not recommended. For example, it's not suitable for children under 18 years of age, women who are pregnant or breastfeeding, people with severe kidney problems. Possible side effects. Side effects of varenicline can include feeling and being sick, difficulty sleeping, insomnia, sometimes with vivid dreams, dry mouth, constipation or diarrhea, headaches, drowsiness, dizziness. Speak to your GP if you experience any troublesome side effects. Bupropion, Zyban. Bupropion, brand name Zyban, is a medicine originally used to treat depression, but it has since been found to help people quit smoking. It's not clear exactly how it works, but it's thought to have an effect on the parts of the brain involved in addictive behavior. Where to get it and how to use it. Bupropion is only available on prescription, so you'll usually need to see your GP or contact an NHS stop smoking service to get it. It's taken as 1 to 2 tablets a day. You should start taking it a week or two before you try to quit. A course of treatment usually lasts around 7 to 9 weeks. Who can use it? Bupropion is safe for most people to take, although there are some situations when it's not recommended. For example, it's not suitable for children under 18 years of age, women who are pregnant or breastfeeding, people with epilepsy, bipolar disorder or eating disorders. Possible side effects. Side effects of bupropion can include dry mouth, difficulty sleeping, insomnia, headaches, feeling and being sick, constipation, difficulty concentrating, dizziness. Speak to your GP if you experience any troublesome side effects. E-cigarettes. An e-cigarette is an electronic device that delivers nicotine in a vapor. This allows you to inhale nicotine without most of the harmful effects of smoking, as the vapor contains no tar or carbon monoxide. Research has found that e-cigarettes can help you give up smoking, so you may want to try them rather than the medications listed above. As with other approaches, they're most effective if used with support from an NHS stop smoking service. There are no e-cigarettes currently available on prescription. For now, if you want to use an e-cigarette to help you quit, you'll have to buy one. Costs of e-cigarettes can vary, but generally they're much cheaper than cigarettes. Smoking in your unborn baby. Protecting your baby from tobacco smoke is one of the best things you can do to give your child a healthy start in life. It can be difficult to stop smoking, but it's never too late to quit. Every cigarette you smoke contains over 4,000 chemicals, so smoking when you are pregnant harms your unborn baby. Cigarettes can restrict the essential oxygen supply to your baby. As a result, their heart must beat harder every time you smoke. Benefits of stopping smoking in pregnancy. Stopping smoking will help both you and your baby immediately. Harmful gases, such as carbon monoxide, and other damaging chemicals will clear from your body. When you stop smoking, you will reduce the risk of complications in pregnancy and birth. You are more likely to have a healthier pregnancy and a healthier baby. You will reduce the risk of stillbirth. Your baby is less likely to be born too early and have to face the breathing, feeding and health problems that often go with being premature. Your baby is less likely to be born with a low birth weight. Babies of smokers are, on average, 200 g, about 80 z, lighter than other babies, which can cause problems during and after labor. For example, they are more likely to have problems keeping warm and are more likely to get infections. You will reduce the risk of sudden infant death syndrome, SIDS, also known as cot death. Stopping smoking now will also help your baby later in life. Children whose parents smoke are more likely to suffer from asthma and other serious illnesses that may need hospital treatment. The sooner you stop smoking, the better. But even if you stop in the last few weeks of your pregnancy, this will benefit you and your baby. Secondhand, passive smoke harms your baby. If your partner or anyone else who lives with you smokes, their smoke can affect you and your baby before and after their birth. You may also find it more difficult to stop if someone around you smokes. Secondhand smoke can also reduce your baby's birth weight and increase the risk of sudden infant death syndrome, SIDS, also known as cot death. Babies whose parents smoke are more likely to be admitted to hospital for bronchitis and pneumonia during their first year. Nicotine replacement therapy. You can use nicotine replacement therapy, NRT, during pregnancy if it will help you stop smoking and you're unable to stop without it. It's not recommended that you take stop smoking tablets such as Champix or Zyban during pregnancy. NRT contains only nicotine and none of the damaging chemicals found in cigarettes, so it is a much better option than continuing to smoke. It helps you by giving you the nicotine you would have had from a cigarette. You can be prescribed NRT during pregnancy by a GP. You can also buy it over the counter without a prescription from a pharmacy. NRT is available as patches, gum, inhalator, nasal spray, mouth spray, oral strips, lozenges, microdubs. If you have pregnancy-related nausea and vomiting, patches may be a better solution. NRT patches should be used for no more than 16 hours in any 24-hour period. The best way to remember this is to remove the patch at bedtime. Before using any of these products, speak to a midwife, GP, a pharmacist or a specialist stop smoking advisor. By getting this specialist advice, you can be sure that you're doing the best for your baby and for you. Remember, you are twice as likely to be successful at quitting if you get some support from a trained advisor. Licorice-flavored nicotine products. Pregnant women are advised to avoid licorice-flavored nicotine products. Although there is no known risk with small amounts of licorice flavoring, the manufacturers advise caution. This caution is based on information about the adverse effects associated with excessive amounts of licorice root. As other flavors are available, pregnant women are advised to choose an alternative such as fruit or mint. E-cigarettes in pregnancy. E-cigarettes are fairly new and there are still some things we do not know. However, current evidence on e-cigarettes indicates they are much less risky than smoking. Cigarettes deliver nicotine along with thousands of harmful chemicals. E-cigarettes allow you to inhale nicotine through a vapor rather than smoke. By itself, nicotine is relatively harmless. E-cigarettes do not produce tar or carbon monoxide, the two main toxins in cigarette smoke. Carbon monoxide is particularly harmful to developing babies. The vapor from an e-cigarette does contain some of the potentially harmful chemicals found in cigarette smoke, but at much lower levels. If using an e-cigarette helps you to stop smoking, it is much safer for you and your baby than continuing to smoke. Unlike nicotine replacement therapy, NRT, such as patches or gum, e-cigarettes are not available on an NHS prescription. If you want to use an e-cigarette, you can still get free expert help from a stop smoking advisor. What are e-cigarettes and how do they work? An e-cigarette is a device that allows you to inhale nicotine in a vapor rather than smoke. E-cigarettes do not burn tobacco and do not produce tar or carbon monoxide, two of the most damaging elements in tobacco smoke. They work by heating a liquid that typically contains nicotine, propylene glycol and/or vegetable glycerin, and flavorings. Using an e-cigarette is known as vaping. What types of e-cigarette are there? There are a variety of models available. Cigalikes look similar to tobacco cigarettes and can be disposable or rechargeable. Vape pens are shaped like a pen or small tube, with a tank to store e-liquid, replaceable coils and rechargeable batteries. Pod systems are compact rechargeable devices, often shaped like a USB stick or a pebble, with e-liquid capsules. Mods come in different shapes and sizes, but are generally the largest e-cigarette devices. They have a refillable tank, longer-lasting rechargeable batteries, and variable power. How do I choose the right e-cigarette for me? A rechargeable e-cigarette with a refillable tank delivers nicotine more effectively and quickly than a disposable model and is likely to give you a better chance of quitting smoking. If you're a lighter smoker, you could try a Cigalike, vape pen or pod system. If you're a heavier smoker, it's advisable to try a vape pen, pod system or mod. It's also important to choose the right strength of e-liquid to satisfy your needs. A specialist vape shop can help find the right device and liquid for you. You can get advice from a specialist vape shop. Will an e-cigarette help me stop smoking? Many thousands of people in the UK have already stopped smoking with the help of an e-cigarette. There's growing evidence that they can be effective. Using an e-cigarette can help you manage your nicotine cravings. To get the best out of it, make sure you're using it as much as you need to and with the right strength of nicotine in your e-liquid. A major UK clinical trial published in 2019 found that, when combined with expert face-to-face support, people who used e-cigarettes to quit smoking were twice as likely to succeed as people who used other nicotine replacement products, such as patches or gum. You will not get the full benefit from vaping unless you stop smoking cigarettes completely. You can get advice from a specialist vape shop or your local stop smoking service. Getting expert help from your local stop smoking service gives you the best chance of quitting smoking for good. How safe are e-cigarettes? In the UK, e-cigarettes are tightly regulated for safety and quality. They're not completely risk-free, but they carry a small fraction of the risk of cigarettes. E-cigarettes do not produce tar or carbon monoxide, two of the most harmful elements in tobacco smoke. The liquid and vapor contain some potentially harmful chemicals also found in cigarette smoke, but at much lower levels. What about risks from nicotine? While nicotine is the addictive substance in cigarettes, it's relatively harmless. Almost all of the harm from smoking comes from the thousands of other chemicals in tobacco smoke, many of which are toxic. Nicotine replacement therapy has been widely used for many years to help people stop smoking and as a safe treatment. Are e-cigarettes safe to use in pregnancy? Little research has been conducted into the safety of e-cigarettes in pregnancy, but they're likely to be much less harmful to a pregnant woman and her baby than cigarettes. If you're pregnant, licensed NRT products such as patches and gum are the recommended option to help you stop smoking. But if you find using an e-cigarette helpful for quitting and staying smoke-free, it's much safer for you and your baby than continuing to smoke. Do they pose a fire risk? There have been instances of e-cigarettes exploding or catching fire. As with all rechargeable electrical devices, the correct charger should be used and the device should not be left charging unattended or overnight. Reporting a safety concern with e-cigarettes. If you suspect you have experienced a side effect to your health from using your e-cigarette or would like to report a product defect, report these via the yellow card scheme. Is e-cigarette vapor harmful to others? There's no evidence so far that vaping causes harm to other people around you. This is in contrast to secondhand smoke from smoking, which is known to be very harmful to health.